And then we will, perfect. We will go ahead and jump into our announcements. So our agenda, we're just going to go over our announcements, our data update as usual, and then we'll cover the new CDC community levels guidance and do some Q&A. So as far as test kits go, we continue to have a good supply of test kits for schools. Again, these do require a CLIA waiver. So if you are interested in getting test kits, please put in your request. If you need assistance with your CLIA waiver, you can always reach out to the school support at pima.gov email address. We'll point you in the right direction. We also have availability for vaccine clinics by the end of the school year. Please complete the interest form if you would like to schedule a clinic, and PMG will reach out to you directly to set up the date and confirm all the details for that event. I mentioned this last time, but just as a reminder, we do have a monthly call for early childhood education and childcare centers. If your district has a center that you would like them to attend this call, please let us know. You can send their contact information to schoolsupport@pima.gov. We'll get them added to the invitation, to the list. But if you're unable to attend the call, but you would like to see the information, we're also adding these calls to our YouTube page, the recordings. All right, let's hop into some data. I'm actually really excited to present this data to you today because things have improved so drastically. Things really dropped after the Omicron surge in January, but I wasn't sure where we would really plateau. But I was updating this data from what it was 2 weeks ago at our last school call, and some of these numbers are at like 25% of what they were just 2 weeks ago. So things continue to drop really rapidly. Just great news for all of us. So as of today, we have dropped out of high transmission to substantial transmission, which is great. We haven't been out of high transmission for several months now. Our rates continue to decrease. We've had 966 cases in the county in the last 7 days. We're down to 92 cases per 100,000 people. Just a week ago, we sent out an email and we were at 238. So we're at less than half of where we were even 1 week ago. Our test positivity also was cut in half. We're now at 9%. And our population of 5-year-olds and older who have been vaccinated continues to increase. We're now over 71%. So this is all really wonderful news. Here's the schools data. I included it in the last couple weeks. Last week, we don't have a lot of data because we were gone for President's Day and then you guys were out for rodeo break, so very few cases were reported during that time. So all of last week, we only had 73 cases reported. The week before, we still had 600 cases reported from schools, including 658 close contacts. But again, these numbers have dropped drastically since then. So I want to talk to you a bit more. I know we sent out an email last week about the new CDC community levels guidance, but I want to kind of go over what this means. So we had kept telling you that the 100 cases per 100,000 people was this big threshold for us. And once we drop below that, then things might start changing. And then this new community levels guidance came out last week. So we wanted to go over some of this with you. Part of the purpose of changing to this community levels guidance is just to be more inclusive of the effects of COVID in your community. It's supposed to be more local data instead of relying just on case counts. This also kind of takes into consideration things like hospital capacity, and then it's more reflective of the fact that a lot of people in the community now have immunity either from previous infection or from the vaccine. And so they just decided to create this new system that they felt was like a more holistic view of what is happening in our local communities. So I'm actually going to just take us to the website. Please let me know if you cannot see this webpage. I believe you can. But this is the main community levels webpage. This is what the map looks like. It was last updated the 24th. We are expecting an update to happen today. Unfortunately, it has not yet happened, but our understanding is that this will be updated weekly. So today will be the day sometime today. Usually things are updated by around lunchtime, maybe 1 o'clock, because the CDC is in Eastern time. If they're updating things by the end of the day, usually it's pretty early afternoon for us. So keep an eye out. So this is the main page. This still shows us here in Arizona. Pima County is still at the high level. Again, this was based on a week ago, and our rates have dropped by more than half since then. So we'll kind of go over what the current data is telling us. This is how the CDC is measuring community level. So that case count per 100,000 people has changed from 100,000 to 200,000. And there's kind of two sets of data here, or two sets of options, I guess. So if you have more than 200 cases per 100,000 people, then you are in this category down here. And then from there, you look at how many new COVID-19 admissions there were to the hospitals per 100,000 people in the last 7 days, and then the percentage of inpatient beds that are staffed, that are occupied by a COVID-19 patient. So these are the two hospital indicators that they're looking at. If you fall in this 200 cases or more per 100,000 people, then you automatically can't be in low transmission. But based on this information, this is going to tell you if you're in medium or high. If you have less than, and this is where we were last week, we were barely in high, but we were in high a week ago. And then if you have less than 200 cases per 100,000 people, then you fall into these categories here. Again, it's the same hospital indicators, but the numbers have changed slightly. So these numbers are in the low now, medium and high is fairly substantial. So now we are in this category because we are at 92 cases, I think I said, per 100,000 people. So we would have moved from this category up to this group. So I'm going to show you now where you can find this data. So in the CDC COVID data tracker, which is in the slides, if you Google CDC COVID data tracker, it will bring you also right to this page. It's pretty easy to find. But this is the page that we have been kind of relying on for our information, our data. So you want to go to your community and then county view so that we can really identify the data from our county. All right, and the difference between this data and the community levels data is that the COVID data tracker is updated every day. And again, the community levels is only updated once a week. So there is going to be a lag between what this data tracker is telling us and what the community levels are telling us. So just be aware of that. So this gives us kind of a snapshot of our 7-day metrics. So the top one is our case count. So that's 966 cases. Per 100,000, it's 92.24. So that's our first, on the community levels page, that's our first indicator, that we're looking for, is how many cases per 100,000 people. The next one is new COVID-19 admissions per 100,000 people and the 7-day total. So if you're on the COVID data tracker page. You're going to scroll down, and this information is in this hospitalizations in Pima County section. That's where you're going to be able to find these other 2 data points, so you can kind of have an idea of where we're headed at least. So this is the new admissions. New admissions with COVID-19 per 100,000 in the last 7 days. So right now we're at 11.4. And if we go back here, we can see which category that fits into. And then for this one, percent of staffed inpatient beds occupied by COVID-19 patients. Again, if we go back to the data tracker, that's the next data point down. And we're at 6.6%. And so we can go back to community levels and see that 6.6% actually would put us in the low category. So we're at medium and low. My understanding is that we would be at medium level, because I think for us to change from high to medium or medium to low, all indicators would have to be in that category. So my guess is that today at some point when they update this community levels map, we will go from high to medium. So what does that mean if we're changing our community level? So if you scroll down here, this shows a whole table of mitigation measures that should be in place essentially, depending on what level you're at. This is a little confusing because they have split it into individual or household level prevention behaviors and community level strategies. So you're mostly going to want to look at the individual level. The community level would be more like things that the county could do or the city could do to have mitigation measures in place. One thing that makes this difficult is that, so the high community levels obviously has the most mitigation factors listed, but the thing that makes this difficult is that the CDC, instead of spelling out exactly what you should do for medium or exactly what you should do for low, they just kind of fail to mention the things that aren't as strong of recommendations. So the biggest one that's going to affect all of you is masking. So in high community level, wearing a well-fitted mask indoors in public, regardless of vaccine status, including in K-12 schools and other indoor community settings. That's the first bullet point. For medium, it doesn't say anything about masking. So it just kind of fails to say anything at all. We have taken this to understand that means at medium level, masking then becomes optional. For the schools specifically, these decisions are likely made at your district level. If you're a private school, you might have more individual control over your own school. But generally, these decisions are made at the district level. And so that decision may be, there's a lot of plane activity here today. So I apologize if you can't hear me. But at the district level, you may decide that within schools, you want to continue masking because you want to take away some of the other mitigation measures like spacing out the desks or things like that. So those decisions can be made by schools. We're happy to provide guidance. I would also recommend just looking at the CDC page when taking into consideration what any changes that you want to make at the school or district level. The unfortunate part about this is that none of this is mentioned in the ECE or early childhood or child cares are not mentioned here. There is a web page dedicated to early childhood centers. It has not been changed since January. So on this webpage, it still recommends universal masking for anyone 2 and older in early childhood. Here it is down here. In a child care center. we don't know how this is going to change because vaccines are still not available for this population. We're not sure if or when the CDC will update that. Again, what they have been doing with more recent updates is instead of being explicit about their recommendations, they might just kind of not mention something. So while on the COVID levels, community levels page, it explicitly talks about K-12 schools, unfortunately, it doesn't talk about early childhood centers. So that is some data that we are hoping will be updated, and we anticipate getting some new guidance and recommendations for that population. Unfortunately, we don't have that at this time, so just be aware of that. But that's pretty much all I wanted to cover. I just wanted to show you guys these websites, these web pages where the data is coming from. They're both linked here, both the data tracker that has the individual data points and the community levels that shows you the thresholds for each data point. This also links to the ECE guidance page for you to see. And again, it hasn't yet been updated. So we do hope that that happens soon. But that's all the information that I have regarding the new pages. Things will likely continue to change once they changed guidance in December. Kind of took a couple weeks for all of the guidance to roll out, so things may continue to change. One really important part I wanted to mention that I failed to mention earlier is our understanding is that the guidance for quarantine and isolation has not changed. So while you may not have universal masking in your school, if someone is in school the last 5 days of their isolation period or the last 5 days of their quarantine period, our understanding is that masking is still a requirement for that. So masking is still involved in quarantine and isolation. The universal masking is the guidance that has changed. So hopefully that clarifies things. I'm happy to take some questions if you guys want to unmute. Seen a couple in the chat. Let me see, do you guys have Binax Now tests yet? So the tests that we have, so we have antigen tests. I don't believe they're Abbott, which is the maker of the Binax Now, but we do have antigen test cards available, so you're welcome to put in a request. Will you be speaking about the CDC changes to investigation and contact tracing? Lisa, sorry. The Air Force is setting off car alarms over here today, so that's exciting. So I don't know exactly what you're referring to. You're welcome to unmute. I believe you're talking about the movement kind of away from contact tracing.
Yeah, I'm talking about the new update that says the CDC does not recommend continuing to prioritize case investigation and contact tracing. So I'm just wondering how the local health department is going to adapt to that recommendation.
Yeah, so we definitely still see value in case investigation. It actually becomes more valuable as our case counts drop to help kind of identify close contacts and things like that easier. When we have such high rates of infection in the community, then it's just kind of ubiquitous and it's more difficult and more, yeah, it just has less value. But we do see there's continued value in case investigation. So that will be continuing. Contact tracing, there is kind of a movement away from contact tracing overall. It's still recommended in some types of facilities, like our long-term care facilities. Schools is still included in that. And the idea is to identify and remove people that could further spread infection. So we do see contact tracing changing, Although as masks are dropped or other mitigation measures, we do still believe that quarantine is an important part of infection control. With fewer other mitigation measures in place, then if somebody does become positive, it's going to be a lot easier for that, for COVID to spread from that one person if there aren't these other mitigation measures in place anymore.
Yeah, for that, I'm just seeing the key points and the rationale is to continue those activities for institutions or area employers of high risk, and schools are not areas of high risk. So, and as the case counts are going down, I don't know about other school districts or other employers, but we're peeling people off of COVID support, so we'll have fewer hands to be able to support that continued activity.
Yeah, absolutely. And I to be completely upfront, I think that our decisions and our guidance around contact tracing will continue to change over the next several months here at the health department, as we are also making changes to our COVID response and kind of our overall community level response. So I don't have any this is where we're headed, this is the decision that's been made, but I think it's going to continue to evolve. So test mask day, is test mask day still being utilized? So yes, we have tests available. So I think test mask day, when things are much more manageable at the levels they are now, test mask day is a great way to keep kids in class as long as they are asymptomatic and testing negative. It will help cut down on all those quarantine times. So I definitely would recommend using it if you are able to implement it. Yes, we do have the tests available for that. CDC also changed the definition of fully vaccinated and up to date. So I'm not sure, Erica, if you want to unmute and give me some information you can. I'm not sure that this has changed recently. Go ahead.
So Kat, in the past, I know that I read somewhere that being fully vaccinated, as far as 18 and over for adults, it was 2-shot series plus the booster. In a K-12 setting, it was just the two primary shot series. But apparently, with the change in the verbiage of the CDC, being fully vaccinated is now the primary series, and up to date would be 2-shot and boosted. So I had a staff member that was exposed, and she said she was vaccinated, but she was not boosted. So technically, she would have been kind of grouped with unvaccinated, and she should have quarantined at home. Luckily, when she came in, she only came in for a few hours, and she was isolated, and I didn't have any close contacts. But I didn't realize that had changed.
Yeah, so that has changed. It's very confusing. So I mean, it's not that confusing, it just makes things more unclear. But right. Yes, so fully vaccinated does mean you have received your original series doses, whether that's 1 shot of J&J, 2 shots of Moderna, 2 shots of Pfizer. If you're immunocompromised, then that would be 3 shots of each. So that's your original series. Your original series is complete, and you remain fully vaccinated until you are either 2 months beyond your initial J&J or 5 months beyond your initial dose of Moderna or Pfizer. This is all for 18 and over.
Right.
Once you pass that timeline, if you have not gotten whatever boosters you're eligible for, then yes, you kind of go back into the unvaccinated sort of category when it comes to quarantining and things like that. If you have received all available boosters that you are eligible for at the time, then you are considered up to date, which then you have different quarantine recommendations. So yes, it makes it confusing. We have kept for K-12 students, we have kept sticking with fully vaccinated as far as discussing the quarantine and isolation. Part of the reason for that is because I think parents who have gotten their child vaccinated, who have maybe not gotten them boosted yet, having them be put in the unvaccinated category as far as quarantine is concerned, kind of penalizes them in a way. It doesn't reward them for actually getting their child vaccinated, going through their trouble to do that. Sorry, there's another plane coming. Moment. Okay, my apologies. So we've decided that for at least this school year until May, we are sticking with fully vaccinated as the requirement for K-12 students. I know that's quite complicated, but if you have any questions, happy to go.
No, thank you very much.
Mm-hmm. Do we know how many schools in Pima County have removed their mask mandate? I don't have that information. I know that districts are beginning to make that decision. I don't have any data on who is doing that. Recommend pool testing. We do still recommend testing. Surveillance testing will help you identify cases still, so that continues to be a valuable tool. Is that somewhere? Sorry, one of the questions says, is that somewhere in writing so that you can show parents and staff who ask for documentation? I don't know what it is that you would like in writing, but if you want to clarify, Joanne, I'm happy to answer that question. But we are at, I will continue to ask about any changes to contact tracing, case investigation, and what we as a county would recommend for schools. Hopefully by next Thursday, I can get some clarified information for you all. Oh, the fully vaccinated definition, yes, it is on the CDC website. I'll find the link for you, Joanne. But hopefully I can get some updated information for you all on kind of where we're headed with contact tracing, case investigation as a county, and have some more information for you next week. Other than that, we'll go ahead and wrap up. We will send out a follow-up email with the links, the slides, all of that stuff. So thank you all so much for joining us this week. We also hope to begin covering more on this call outside of just COVID. Now that COVID is calming down, we want to take advantage of that and being able to talk about some other exciting things that we have in the works for our partnership with schools. So we hope that you will come back for more exciting information that is not COVID related. So thank you all for joining us today. Feel free to reach out to schoolsupport@pima.gov with any questions, and we will speak to you soon. Thank you all. Have a great rest of your day.